I'm going to perform task number 18, which is just performing a bacterial culture and sensitivity. So I have all of my supplies right here. I have my blood agar petri dish right here with the lid on. I have a sterile swab that I'm going to use to collect my sample. I have my patient sample, which is labeled with the patient's name, date, species, and also wrote that it is vaginal discharge, okay, which you can see at the bottom of my tube, right at the bottom right there, okay. I have antibiotic disc for culture and sensitivities in case we see any colony growth in 24 hours. I have a pen in case I need to label anything else. And I have my patient label over here, again, has all of the patient's information, patient's name, date, the date of birth, the species, that it's a canine mix. It's for Dr. Duffy, and the test is bacterial culture and sensitivity, which we'll be placing on the lid of the petri dish once we are done putting our sample on it. So, and of course, most importantly, I have my homemade incubator right here, nice styrofoam box that's going to keep it nice and hot or warm. And once we're done setting everything up in there, we'll put it outside, and the heat from the sun will keep the styrofoam and our sample nice and warm. And inside we have a shelf that we're just going to put our sample onto. Okay, so we're going to go ahead and get started. First things first I want to do, I'm going to open up my sterile swab. My fingers can get there. Okay, so we're going to open up our sterile swab. We want to be careful not to touch the end of the cotton swab to anything. We want to keep it as sterile as possible. We'll put this to the side because we don't need that part. I'm going to open up my patient's sample, which again was just a little vaginal discharge from Sweetie, who is a 16-year-old female spayed canine mix. So we're going to keep our sterile swab this way. We're going to take off the lid. We're gently going to put our cotton swab sterilely into the tube, and we're going to mix the bottom of the swab all around at the bottom, making sure that it gets on all corners of my swab, so I have a nice sample to put onto the petri dish. Okay, looks like we're nice and mixed, so I'm going to pull back up, and again I'm going to try to keep it as sterile as possible while I put the lid back on the tube from my patient sample. And put that over there. So then what I'm going to do, I'm just going to take off the lid off of the agar plate. And then what we want to do is I'm going to inoculate my sample over the agar on the petri dish. I want to make sure I get all four corners. So up here, we're going to do my initial up here. It's going to be 1. Okay, we're going to turn it a little bit. Continue on, which is going to be 2. Okay, we're going to turn it a little bit more. We're going to do the third part over here, about halfway down. Okay, and then last but not least, we're going to turn, and on the last part, I'm going to just turn it this way. Going to go all down on that one as well. 4. Okay, so I'm going to go ahead and throw out my cotton swab because I don't need that anymore. And then if you can kind of see on the dish from the glare from the light, I did 4 different sections. Okay, and then there's a little line in the middle just to divide it so that I know I have 4 different sections that we're going to see if we see any growth. So I'm going to come back over here, and then we're going to put the lid back on the petri dish. And I'm going to go ahead and again I'm going to take my patient label, which has the patient's name, date of birth, the date, female spayed canine, the owner's name, and it's for Dr. Duffy for a bacterial culture and sensitivity. I'm going to go ahead and I'm going to put that on top of the lid for the petri dish, which now has our sample swabbed in the agar that's within the petri dish. We're going to go ahead and pick that up. We're going to take off the lid for our incubator. Again, I have a little shelf in here so that it's not directly on the floor of the styrofoam. So it's on top of there, and then we're going to go ahead and put our lid on here. Make sure it's nice and shut securely. This way, when we bring it outside into the sunlight, it'll get warm and our sample is going to incubate. We're going to leave it in there for 24 hours, and then in 24 hours after our sample has been incubating, we're going to take a peek and see if we see any kind of colony growth of any sorts. So for right now, that's part 1 of task 18, which is performing a bacterial culture and sensitivity. Again, we're going to let our sample incubate for 24 hours, and then we're going to take a peek and see if there's any growth of any kind.